Afternoon and good morning to you if you are on the West Coast. My name is Jose Leon. I am the Chief Medical Officer for the National Center for Health in Public Housing. Thank you for attending our session number 2 on implementing the smoking cessation programs in health centers. This is a live session. At this moment, our lines are muted. If you have any questions, please use the chat box at the end, or you can also use the raise hand icon and your question will be unmuted. This session, we are trying to have participation from all of you. Your feedback and information will be very, very useful for all of us. Please be ready to share your thoughts, your experience, and give us some feedback. Before we get started, again, we are the National Center for Health in Public Housing. The National Center for Health in Public Housing is funded by HRSA to provide training and technical assistance to health centers, especially those health centers located in or immediately accessible to public housing. There are 108 public housing primary care grantees, and in 2019, these health centers served over 800,000 patients. In regards to public housing residents, there are over 1.7 million residents living in public housing. There are some social determinants of health and some demographics that I would like to highlight. 45% of those living in public housing are African American, 25% Hispanic, 37% are under the age of 17, 52% are white, and there are percentage over 35, specifically 38% of them are disabled, and 93% of those are low income. In a recent publication from HUD and the Centers for Disease Control and Prevention, a health picture of HUD-assisted adults data from 2006 to 2012, we got information about the main chronic conditions affecting public housing residents. As you can see here, there are two that I would like to highlight: COPD and asthma, since they are very related to smoking, and 13.6% of those live in HUD assistant or receiving HUD assistant housing had COPD, and 16% or over 16% of them had been diagnosed with asthma. There is new information out. We hope to update this information soon, since the new data has been released by the Centers for Disease Control and HUD. So stay tuned. Just a reminder, we have some handouts. If you haven't been able to download the handouts, this is a very good opportunity. Either you can go to the handouts section and go to webinar and download all the handouts and materials that we have for this session and for the next sessions. Also, you can go to Moodle and create an account and provide feedback or get the recording and the slides and all the information that you need. Our next session will be November 16th from 1 p.m. to 2 p.m. and it's going to be a quick day and dealing with stress. So we are going to hear from Frank, who is the National Director of Pharmacy and Partnership for Tobacco Cessation. And Frank has been working on smoking cessation for many, many years, and he's been willing to provide his expertise for all the health centers attending this session. So I will turn it over to Frank. Good afternoon, Frank.
Good afternoon. Thank you. All right. So first of all, because this is a small group, I'm going to ask you to turn on your cameras so that we can at least see each other a bit and have some interaction. before I actually go into the information that I have today, I would like to get your feedback, first of all, about the information that I provided in the last session, you know, the general information about what to do for cessation, you know, the topics to cover. But I'd also like to get your, like to get some feedback from you on what the problems are at your center as to why you haven't been able to do this before. Part of the issue here that got me to this place was I was told that many of the centers want to do cessation but haven't been able to do it for a lot of different reasons. So if you could just get on camera or at least unmute and just give me a general idea of who you are and where you're at and what the issues are, then I can try to address those in the next couple sessions that we have. So is anybody willing to be the first one?
Again, you can either use the raise hand icon and your line will be unmuted, or you can also use the, you can also type your comments in the search, in the, I'm sorry, in the chat box, and your and share your comments or your experience with Frank. So, Fide, can you unmute? There is one person raising the hand.
Can you hear me?
Yep. Yes.
Okay. Excuse me. My name is Layla Kostic. I'm a community health worker at a federally qualified healthcare center in Louisville, Kentucky. And the biggest problem, not problem, quote unquote, but the issue that I have seen is we just have a lot of people that are still in that pre-contemplation stage. So we're having trouble just really getting people moved into the next stage in the model and really ready to quit and then keeping up with it. So that's been my biggest barrier.
Okay. All right, so what this was designed, these trainings were designed specifically for people who are ready to quit. So we'll go through all that information, and then maybe at the end, in the last session, if we have some time, we'll all make some time, let's put it that way. We can cover that, people who are in that stage, because I realize that probably a lot of people are there. We did do a webinar for you guys on motivational interviewing last year. So I don't know, is that recorded, Jose?
Yes, it's been recorded and is on our website. We can share the link after this session, so they can watch the recording again.
Okay, so yeah, so there is a record. I did it. It's an hour long, so you know that is another resource that's available to you. But we can talk about that at the end after we go through all the material I have here for these 4 sessions. No problem. Okay, anybody else?
Thank you for your feedback.
Yes.
Peter, there is somebody else raising the hand.
Yeah, give me 1 second. All right, Barado, you've been unmuted. Barado, can you hear us?
I also see Sarah Arnold. Fide.
All right.
Hello,
Okay.
can you hear me?
Yep.
So I'm Sarah Arnold. I work at a federally qualified health center in Columbia, Missouri called Compass, and I'm a behavioral health consultant. We often talk with patients here at our primary care clinic about smoking cessation, and I think that We've had a grant. It's run out at this time, but we were getting money for patches, lozenges, and gum. And so that was kind of how we were really helping people. That's stopped now. So it's kind of halted my ability to help those who are uninsured. I think that's my biggest barrier right now. But usually it's one-on-one for me.
Sarah, I would suggest that you call it the quit line in Missouri.
Okay.
They many times have programs where they give out free or very low cost product. So they'll be able to tell you. It's that 1-800-QUIT-NOW.
Okay, yeah.
Yeah, if you know the number, I would call them. They would be your best resource to find out if there are if there's product available.
Okay.
And especially at the end of the year or the beginning of the new year, many of the quit lines give out free products because people are interested in quitting more at the end of the year. I mean, at the beginning of the new year than usually any other time of the year. So that is a good place to go.
Thank you.
You're welcome.
Thank you, Sarah.
All right, well, why don't we move on, and then if there's questions.
Just give me 1 second. Frank, it seems that we have somebody else today.
Okay, good.
Yep, give me 1 second. So she provided her input via the chat. So she says, my name is Tiffany Morales, and I am the newly hired social worker at a FQHC in NE, Ohio. My position is new, and we are in the process of establishing a referral/screening process from the health center to me. Thank you.
Oh, good.
Thank you so much, Tiffany.
Yeah, thanks. It's helpful for me to just get a sense of who you are and what your situation is. Okay, so as we said last week.
Sorry, Frank.
Somebody else?
There is Fide, were you able to unmute Baradu?
Let me try it again. I did unmute him earlier and there was no response. So let me try it. Hopefully he's in the line. Hi, Baradu, are you in line? Okay, probably not.
Okay.
He isn't. Okay, Fran, sorry. Go ahead.
All right, no problem. But as I said, if you have questions that come up, please put them in the chat, and Fide will ask me, and then we'll go from there. Okay, so what I want to do is, hopefully you can all see this document here. So this is something that you all should have gotten. If you don't have it, it's on the right-hand side. You can download it now. And this is actually the facilitator guide that I put together for you to be able to actually run a cessation program. So I'm looking at this, and we're going to be talking about this from a group perspective. But as you know, if you're only doing one person individually, you can do exactly the same thing. You're just taking out the group dynamic. So as I mentioned last week, what I wanted you to do, what I hope you have done, is found at least one person that you can work with over the next 6 weeks to help them quit. And what I would like you to do then is, after today's session, you will have gotten information about how to run the first session and the second session. Now, ideally, what you want to do is have these sessions 1 week apart on the same day, but you do not necessarily have to do that. I like that because of the consistency. You know, when you're doing anything like this, you want to stay as consistent as possible. But for our purposes right now, we're just getting you up and going in this and training you in how to do it. So, if you have to do 2 in a week in, next week, that's fine. But the idea here is that you have this week to do session 1, next week to do session 2, And then the following week, on the 16th, we'll meet again, and I will review what to do in sessions 3 and 4. I felt this was a better way to do this, and I've not done this before, but so I'm going to need your feedback once we're done if this is a better way to do it than giving you all the information all at one time. Because I just figure sometimes it's overwhelming to get all that info and have to digest it, whereas this is given it to you in smaller bits so that you can figure out what you want to do and how you want to do it and understand what you're supposed to do in smaller quantities. So I'm not actually going to go reading this whole facilitator guide, so don't worry about that. I'm just going to highlight certain things. You can certainly read it. And as you see, as we go along, this is a step-by-step and as much detail as I can possibly give you about what to do for each one of your sessions and how to run it. So every one of these sessions, it should be about an hour or so. If you want to have the first one a little longer because of the number of people that you're dealing with, that's perfectly fine. But the last few, I'm sure you can do in an hour. I would never have more than 10 people in a group because then it becomes too unwieldy and it's very hard to manage. So at least for you guys right now, starting out, I would only have maybe 4 or 5 people once you actually start to run a group. So doing this time of the year is ideal because this program right now with me will give you practice. And then I would suggest that you start to advertise very soon and set up a group at the beginning of the year. As I said a few minutes ago, many people are interested in quitting as a New Year's resolution. So you can take advantage of that and start your group, the first week of January or somewhere in there. All right, so what are you going to talk about in each one of these sessions? Okay, the first one is just an orientation for the participants and also for you. They can get to know you, you can get to know them, and you're going to give them a basic outline about how this program is going to work. Now, again, this is what I have done over the years. This is what I have seen to work the best. If for some reason you can't actually follow all of this within your health center, I would rather you adapt this to your needs rather than not do it at all. So don't think you have to actually, do exactly what I'm telling you here. It is optimum if you do that, but again, I'm enough of a realist to understand that not everybody may be able to do this exactly the way I am suggesting because of problems and issues at your centers. So keep that in mind as we go through this. So first of all, as I said, this is for you to get to know your patients in the group, but it's also for them to get to know you. Now, you may think this is an odd way to start, but I can guarantee you that the first question everybody has on their mind, and in many cases, they're so preoccupied with it that they're not paying attention to anything else you're saying, is whether or not you were a smoker. There's a cultural bias, and I think it comes from AA, that you have to have done the behavior in order to help people stop doing it. That is not true with smoking. That may work for alcohol, it may work for other drugs, but with smoking, that's not really an issue. So I want you to be honest and upfront with people about your past smoking history. If you've never smoked, I've done this for 33 years now, coming up in January. I've never touched a cigarette in my life. And I can tell you that I've probably helped, and I'm not bragging here, but maybe 12, 14, 15,000 people quit. So it's more about understanding the behavior and giving people the correct information. My example has always been like this. If I needed open heart surgery, would you go to a doctor that had open heart surgery done on himself or herself, or would you go to somebody who's done 500 or 600 operations? And obviously, you'd go to the person who has the experience. So that's how you want to present yourself, is that you've been specially trained in order to help people quit. And, you know, however you want to put that, however you want to say that, if you have a credential that you got from some other source, you know, certainly bring that up. But don't let that be a barrier. You can certainly help. And for the people who are therapists, you know, you certainly do not have all the conditions that all the people who are coming to you have, and you're able to help them. So think through how you're going to approach that. Now, if you were a smoker, I want you to realize that people are not necessarily going to go through the same process that you did when you quit. So don't get stuck in that mode. And I have to say, and I'm hoping that nobody on here is a current smoker, but if you are a current smoker, then I would not recommend that you be running a group or doing cessation counseling, because you really don't have any credibility. If you really want to do this and you are a current smoker, I would suggest that you quit first. Okay, so then, you know, give a very brief introduction about yourself and, you know, what your background is, but then ask each one of the group members to briefly, and you notice I underlined that, introduce him or herself. One of your roles here is to be the policeman in a sense and keep things in order and keep things timely. So do not let people ramble on about their whole life history, because if you give them that opportunity, many people will do that. All you really want to know is a little bit about their smoking pattern, smoking history, what's bringing them to the group right now, what is their motivation for quitting. And again, you've got to really keep a handle on that. Next, you want to outline the schedule. So as I said, you want to have 6 consecutive sessions. This is the ideal. To me, this is the sweet spot. Any more than this, and people get bored. Any less, they don't get enough information. So again, I suggest that this be done once a week for 6 weeks, and that should be a really good, solid program for anybody who wants to quit. Now, if you have somebody after that you're working with individually that just needs more support, by all means, stick with it. And if you are doing therapy with somebody to begin with and incorporating this into that, you can certainly keep talking about this, you know, for months if you have to. In a group situation, I've actually found some groups of people have bonded so well with each other and like each other so much that they've decided to stay together and do their own like support group afterwards. So if somebody wants to do that, that's fantastic. That's great. I would certainly encourage that. But again, 6 sessions to give the basic information, I think is ideal. Then you really want to talk about what's going to be happening in the room. And here, the one thing I want you to really focus on, and as you see, I have the word real in quotes. This isn't group therapy in the same sense as doing a psychological or psychiatric or therapy group. But I want you to really approach it that way in the sense that everything is confidential. We all, no matter where we're at, you know, even if you're in New York City, the little group that you're in or the place that you're working is its own little microcosm of culture, and it's small, and people know each other, people run into people who know other people. And early on, you know, I remember this at our health center, that somebody got in an elevator and was talking about what was going on in the group, and another person in the elevator was the husband of the person that individual was talking about, and it got really messy because he realized what this person was talking about. So the point here is that what is said in the room stays in the room. I think that makes everybody then more comfortable to be open and honest. And you will find as you get into this that there are many, many issues tied into why people are smoking and why they are having trouble quitting, that, you know, that they may feel very uncomfortable revealing if they think that the information is going to get out and the people are going to be talking about them. So approach it from that perspective. All right, so that's kind of the general information, the general how to do this. But so then you really want to get into some education here. You want to really talk about what we discussed last week, the 3 aspects of smoking. So the addiction to nicotine, the habit, and the psychological dependence, and how we're going to address all 3 of those. So as we just mentioned, we are going to encourage, and I am going to encourage you to encourage everybody to use some kind of cessation product when they quit. It just makes the whole process more comfortable for them, and the data is overwhelming. There's no question about it that using a product, even for a short period of time, increases quit rates dramatically. So there's really no reason, and I'm going to say this too to the individual that was talking about the getting free or low-cost medication. Right now, in most states in this country, it costs less to use the gum or the patch or the lozenge per day than it does to smoke. So I really want you to look at the individuals and speak with them who are telling you they can't afford to use the medications, because unless they're making their own cigarettes, which they might well be, or they're smoking some really generic low-cost brand, they are spending more per day on cigarettes than they would if they used the gum or the patch or the lozenge. So it's just those 3 over-the-counter products that are that cheap right now. So really help them understand that and do the math. Add up how much they're spending a week and show them how much it is for a year, and then look at the fact that they're only going to be using these products for a couple of months, so they're really going to be saving a lot of money. However, I do acknowledge that there are a significant number of people who probably really don't have the money to buy a box of patches or gum because they just don't have that. They buy the cigarettes maybe a pack a day. They're just buying it every day or a couple days, or bumming a lot of cigarettes. So I acknowledge that there may be issues there, but don't let that throw you, or don't let it be the reason why they can't participate. Emphasize that there is going to be a quit day, and that is the 3rd session. So right now, when you set this program up, whatever the 3rd time is that you're meeting with this person or your little group, that's the day they quit. Now, when you have a group, you are setting the quit day. You have to build that into the pattern and the schedule. If you're working with somebody individually, there is a little bit of leeway there for them to actually pick the quit day. But this is a really important indicator to know whether or not somebody's serious about this. If you indicate that they're getting in a group January 1st and the quit day is January 15th, and they balk at that or hesitate, then they're not ready. Or if you're working with someone individually and they're hesitating about setting a quit day, again, you know that they're really not ready. So that's a good indicator there that you are, for you to know how serious somebody is about doing this. Then when we go back to the medications, if you're unsure, you don't want to talk about them, you're uncomfortable, and you're at a health center, they can talk to their MD or the pharmacist. Many pharmacists now in many states are able to prescribe any of the medications. We're trying to do that here in Pennsylvania. I'm in Pittsburgh. I know Indiana, New Mexico, Oregon. There's a bunch of states that allow this. So check with the people in your facility about who they can discuss the medications with. If they're going to use bupropion or varenicline, so the 2 non-nicotine medications, that has to be started a week before the quit day to build up a therapeutic blood level. Everything else, they're going to start the day they quit. So, you have a lot of resources, including me, to ask questions about the products if that comes up. And I want you to emphasize with them that these are not pills to make them quit. They're just a way to reduce or eliminate withdrawal symptoms. And we talked about that last week. What you're going to really focus on quite a bit in this session is teaching them about coping, and that is the whole key to quitting. And if you remember what we said before, coping is learning how to deal with the urges, desires, and triggers for a cigarette without having one. So what we're going to be doing with each of the people in the group or your individual person is determining what their pattern and routine is around their own smoking, and then helping them understand how to deal with those desires and urges without having a cigarette. So you're going to just introduce that concept and go through it in general with these suggestions here. So, you know, you can read that through yourself on your own. You can read that on your own, and but that's kind of what you're going to be explaining to the patient. Okay, and then what I want you to finish up with is this handout called What's in a Cigarette. I really like this. I really use this quite a bit. And as you can see, it lists a lot of the chemicals that are in cigarettes that people are not aware of. So we are so focused as health professionals on telling people they have to quit that in many respects we forget to say why. So for Layla, you know, for people who are in pre-contemplation, this is a great thing to show them, because they kind of have this myth in their head that smoking really isn't that bad, or it's doing all these wonderful things for me, or it's helping me, and they're willing to ignore what's really in it. So this brings it home. This smacks them in the face. This makes them understand that there are some pretty major toxins in tobacco and in a cigarette that negatively affect their life. Now, it's very important that you understand here, nicotine is the addictive substance, but it's not what causes all the medical problems. Nicotine in and of itself, in the amount you get from a cigarette, now remember that, nicotine in the amount that you get from the cigarette is pretty benign. It's all this stuff that causes the problems. Now, if you want to have fun and if you want to really get into this with your patients, and you can get all this stuff. You know, you can actually buy some paint thinner, ammonia, get some rat poison, all this stuff, and actually show it to people. So again, it's that smack on the head, you know, that this is real. Oh, excuse me. And you know, this is harming their body. So I go through this with each person and each group and make sure that they understand what all this stuff is. Carbon monoxide is probably one of the things you want to focus on, because that is what robs the body of oxygen. If you remember, if you think back, the reason why people die if they are exposed to carbon monoxide is that it pushes the oxygen out of the body. Our body has an affinity for carbon monoxide more than it does oxygen. So if carbon monoxide is present in high amounts, the person becomes oxygen deprived. So most smokers are not getting enough oxygen into their body, and that's why the heart has problems, or that's what causes a lot of heart problems. And it's actually what affects the fetus if the mother smokes, because the fetus is not getting the amount of oxygen it should, so the body isn't growing to the size that it should. The brain, therefore, is smaller, so it just leads a cascade of all kinds of problems. Lead, you know, I find it fascinating that, you know, many people freak out about being in a room that might have lead paint in it, but yet the same people are smoking and putting lead in their body directly. Tar, the average pack-a-day smoker puts in 1 pound of tar in his or her lungs. And I don't know if any of you have ever been to an autopsy or seen anything like that, or, you know, maybe in school they showed you, but if you look at a smoker's lungs, it is actually coated on the inside with tar. You can actually scrape it off. So, you know, it's not good. It's not good. There's acetone. You know, that is the same thing as paint thinner. It's the same thing as nail polish remover. So again, you can focus on this as much as you want. I like to use this. I like to do this because it really kind of breaks the myth about the benign nature of smoking, or that I need to do this, or I have to have it in my life, and shows them what the reality is. Okay, so you review that. It's kind of the, the end of this first session. And then what I'd like I'd like the idea of giving homework to people, or either doing something or thinking about something. So what I want to suggest that you suggest to your patients at the end of this session is to instruct them to pick one situation where they used to smoke and don't smoke in that situation. So maybe after a meal, or or if they're sitting around watching TV, or something easy like that they can identify, and they can actually consciously make a decision not to smoke. And then have them pay attention to how that felt, what happened, what the issues were, how it worked. So that's a really good way of starting to break the patterns and routines. Okay, so that's your first session. There's a lot of information to get out during that first session. So again, make sure you time things properly. The biggest time user is people introducing themselves. So while that's very important and I want you to do it, make sure and control that. Okay, so that's week number 1. So week number 2 is the preparation. So these are very specific steps that you're going to want people to take either before the quit day is the following week or on that quit day. Okay, so number 1, you have to get rid of all your cigarettes. We forget to tell people this, and if we don't, they won't. So this is the one thing in this program where there's no exceptions. Don't let anybody say, well, I have to keep around a few just in case. Well, I always say, just in case of what? They need to get rid of all of them. Now, if they are living with somebody who is a smoker, I have information about that, what to do and what to tell them. So we'll get to that in a few minutes. But they've got to put all their ashtrays away. If they have little pouches they kept their cigarettes in, get rid of those. But by the quit day, they're gone. I know some of you may think that's a bit harsh, but I really want you to think about this like breaking up with somebody, okay? You can't say to somebody, all right, I don't like you anymore. In fact, I hate you. I never want to see you again. But let's date 5 days this week, 4 days next week, 3 days the following week, and then we'll break up. Does that work? Well, we all know it doesn't. As painful as it is, it's better just to say, I'm done, it's over, goodbye, and move on. And then you just deal with whatever comes up and you're finished. So explain it that way to your patients, that it's much better to do that. Now, if you have somebody that's smoking 2 packs of cigarettes a day, so they're smoking 40 cigarettes a day, it's okay for them to taper down to like 1 pack or half a pack or whatever as a way to get ready to quit. So tapering is okay as a way to get ready to quit. It's not a good way to quit. Okay, so really focus on that. And before I go with the others, I realize I skipped the first bullet point there. So every group, what you want to do when you start it from here on in is to allow a few minutes to get feedback on what's happened since the last time you met. So that's just going to be a standard thing you're going to start out with, like, okay, welcome back everybody. Hope you had a good week. So let's take a few minutes to debrief on what's happened. And you can, if you feel like it, go run and ask each person, or just let them start to respond. But it's a good way to find out the temperature of the room and what's happening with people and what the issues are. Okay, so getting back and clean the house, number 1. Number 2, you really want to help each person understand the motivation that they have for quitting. So this is something that you should be discussing in the group and soliciting each person's motivation. If they don't have a clear-cut motivation, then part of the role of the group and part of your role is to help them find one. And then I like to tell people to write that motivation on a little card and keep it with them, so that if they have a time where they're having an issue or a problem or having an urge, they can just pull it out and look at it. and again, be very specific here. You just don't want to write, family on it. And, it's better to write, I want to be here to watch my grandchildren grow up. So be as specific as you can. Then the flip side of motivation is barriers. So even though everybody's here, they're ready to quit, there may be some reasons and some problems and some issues that are keeping them from doing it successfully. So you really want to determine what those are and then to strategize about possible solutions. So this, again, you're going to have to really be, on your toes here, because you're not going to know what people are going to say. So you're going to use that round robin kind of pattern to find out what each person's issues are. And you're going to quickly see that it's going to be pretty much a couple same issues for everybody. And that would be stress, is the big thing. So we're going to do a whole session. The fourth meeting that we have with our group is all about stress management. But you can kind of see the discussion here with some ideas about how to manage stress and what we're going to be doing by looking at that. So go to that session, be familiar with all that information, and we did talk about that at the initial training. Part of the barrier issue is also preventing problems from happening. So that's where this anticipate, plan, and rehearse comes in. So you want people to be able to identify what situations are going to be a problem ahead of time, devise a plan to deal with that situation before it occurs, and then use the group, and this is the great thing with the group, to role play, rehearse how you're going to deal with that situation. If it's just one-on-one, you can role play that with your client. So there's a lot of opportunity here to help them know exactly what to do in a situation that they think is going to be problematic before they get in it. And one of the fun things to do is just to maybe go around the room and you pretend to offer each person a cigarette and then have them actually say the words, "No, thank you, I don't smoke." Because most of the people that you're going to be dealing with have never said that to anybody. So it can be a really profound moment for them to actually say that. So again, as you can see, there's a lot of dynamics in these groups. There's a lot of interesting, fun things that can happen as you're doing this. So it's not necessarily, I don't want you to kind of think about this as a class. You're not the teacher up there just giving out information. You're creating an atmosphere where hopefully these people are all going to be able to interact with each other and give each other support, encouragement, and help. And any of you who've already been trained in group, this is exactly the same kind of group dynamics that occurs in with any other topic. It's just that we're going to focus on smoking here. So as I said, we have a plan to deal with other smokers in the household. So essentially, the key word here is negotiate. This is not about the person who's quitting going in and making demands on the person who's still smoking. Rather, you want them to negotiate, number one, where and when the other person can smoke. My strong recommendation is that they only smoke outside and not in the home. However, if that's doesn't work, can't work, there's a problem with that, then designate one room is the smoking room. The person who's quitting just doesn't go in there, doesn't interact with the smoker while they're in there. Tell the individual smoker to make sure their cigarettes are hidden, because if they're laying around, that might be a strong temptation for our quitter, and to only have one ashtray that they keep clean and stored when they're not using it. And then I always like to tell the person that we're working with to thank the individual who is living with them for doing this by taking them out to dinner or giving them a special gift after a month or two. So it's always a nice thing to thank them about for cooperating. All right, so then you want to focus too on coping. So here is where you are going to really start talking about specifics. And one of the handouts I have is the coping menu. So you're going to know, you're going to have looked at this, you're going to know what to talk about in reference to the, after a meal. So I want you to make sure that you allow enough time for this discussion, because this is very important. So I don't want you to give the coping menu to the person yet, because what I have found is that if you give it to them before the quit day and they start to make changes in their patterns and routines and they're still smoking, then those new changes become connected with smoking. So it's kind of self-defeating. You're just giving them a very concrete example about what you're going to be doing with them the next session, and what you're going to hope they're going to be doing with all the different situations that they're going to encounter when they're not with you, and that they'll be able to use the coping menu when they get it next week. But again, you're getting a little more specific here than the general stuff you talked about last time. And again, that gives you many more instructions there. It's also important at this point to create a very strong support network. So what I recommend, no matter if you're working with them individually or in a group, is that you instruct these individuals to find a support person in their work environment. Now, right now, they may not be going anywhere else other than home, but if they still are in a work environment, person there, a person in their family, and then a person in their friend group. And it's important that you instruct these individuals to find people who they know they can talk to when they need to. You do not want them to find anybody who's going to be a policeman, or every time they see them walking up and smelling them to see if they've got a cigarette. That kind of defeats the whole purpose. So you want to find people who are genuinely willing to help and who will not give them cigarettes if they ask them. So that's very, very important. Now, the other thing you can do is, if you have a group of 8 or 9 people, then what you can do is create a group support list where people can contact each other outside of the group. So, when I used to do this, it was all telephone based, but now you can text, now you can email. So everybody who is willing to be a part of this is part of it. If somebody in the group doesn't want to do this, then they're not going to get this list. So ask everybody to sign up today, and then you make copies between now and the next session and hand those out to the individuals who are part of that list. Okay. I find this to be interesting because in some groups, they really need each other and they call each other and they become friends and helpful each other. Others are not interested. So just do it if they're, if each individual person will determine whether or not they're going to use it or feel comfortable using it. Okay, so the last couple things here are ambivalence. We know that everybody in the room is kind of scared to do this. There's a lot of ambivalent feelings. So deal with that, bring that up. Just like I said, I know you're all kind of anxious about this, and some of you may be scared. So let's talk a little bit about that. Okay. Have a quitting ceremony. Now, we talked about this last week, and again, I find this very powerful, just like that metaphor of the breaking up, is to have a ceremony that says, I'm done. Now, people can do this at home before they come to the group, or I've had some people like the idea of getting a waste can in the room, throwing the cigarettes in there and say, I never want to see you again, or whatever that works for them. So you can set that up as a moment in the group, or instruct people just to do it on their own. But I think And some people won't do it, and that's not any big deal. But for the person that this resonates with, it's very, very powerful. So again, it's perfectly fine if they want to bring that last pack or even one cigarette. I've had people rip them up. I think I told you the story the last time that the former nun that I knew, she actually buried them. I've had people throw them down the toilet. I had a guy who was a runner who realized it was, causing him to get winded, and he ran the marathon here in Pittsburgh. And I don't know if you've been to Pittsburgh, but there's a bazillion bridges here. So we went back to one of the bridges where the marathon started and threw them into the river. So whatever is resonating for that person, as long as it doesn't hurt anybody, is fine. Okay. Finally, you really want to remind everybody to get their cessation medication, and make sure and have a 2-week supply by next week. So what they're going to do is the night before they quit, they're going to have their last cigarette. They're going to have their quitting ceremony if they decide to do it there. Then they're going to get up in the morning and start to use the patch, the gum, the lozenge. If they're on varenicline or bupropion, they already have already started it. So they're going to have their last cigarette, and then they'll see you on the quit day the next day. There's really not any other better way to do that, and most people can get through those first 6, 7, 8 hours before they see you pretty good. So this does seem to work the best. It's the best that I've seen with anybody. And then finally, allow for a few questions. And this is where you want to end on a very upbeat note. You really want to make sure, without being too sugary, that you are confident in their ability to quit, and that, you want to reassure them that you're going to be there as a resource. So even though we know intellectually that not every person in the group is going to quit, I want you to approach this from the perspective that you know for sure that every person in there is going to quit, because your attitude does come across and does influence how people are going to react and how successful they're going to be. So it's always a fresh start with every group, with every person. Be as upbeat, confident, and real as your personality allows you to. You don't want to be the fake, have a good day, like that you get at McDonald's all the time, when the person really doesn't care. So you've got to make that your own. You have to really, you have to really incorporate that and say it in your own words and in your own way and make it sincere. Okay, so again, the idea here is that you have found a person, hopefully by now, or 2 or 3. You're going to have your first introductory session with them sometime this week. The next week you'll do this preparation session, so you'll be able to go through each one of these steps with them. Read this ahead of time for each week. Get really familiar with it so that you know what to talk about, and take the handout with you. You don't have to memorize it for these first couple times you do this. Let people know that this is your first times doing this, and you have the reference there. You have my email address, so please, I'm here. I'm more than happy to help you with any individual issues about how to do this, how to set it up, when to do it, all that kind of stuff. Or if you have questions about specific patients, I'm more than happy to field those too. Again, if you have issues or questions or concerns about the medications, have them talk to their the health center physician or the pharmacist. The pharmacists are excellent resources. And then, as I suggested to who is it, Sarah, if you're needing to get free medication or low cost medication, then call the quit line in your state and ask them if they're having a program right now where you can do that. Oh, excuse me. So We have about 4 minutes left here. So does anybody have any questions about any of this? Either unmute yourself. I don't know if you can unmute yourself, but raise your hand and Fide will unmute you. And
Thanks, Fran, for going over the protocol. And as Frank said, if you have any questions, please use the raise hand icon. Your line will be unmuted, or use the chat box, type your question, and we are going to read the question aloud. In the meantime, Frank, thank you so much for going over the protocol. And Frank, I've heard that we have some outreach staff members as part of the Learning Collaborative session.
okay.
And I do have a question for you. What would be the role, you know, for a community health worker when a health center set up a smoking cessation program like the one that you are describing?
I feel that their best role would be, after the person has quit, to be the continuing and ongoing support and encouragement. And I think an ideal thing for them to do would be to create a drop-in support group for people who are coming to the center who've quit. So almost like an AA meeting, you just have it every Monday night at 6 o'clock, or every Thursday afternoon at 1 or whatever, and that the community support worker can be the leader for that and help the people strategize about any issues or problems that come up and act as a resource to make sure that they stay quit. I really find that that's part of the problem with all of this, no matter where it's done, is that we have a lot of resources available for people while they're quitting, but once they're done, we kind of lose touch with them, or we give them the support they need. And some people need a couple months of contact with somebody to be able to actually cement the quit. So that would be my primary recommendation for them to fit into this process.
Thank you, Frank. Fide, I thought that there is a question. Do you see the by any chance?
Yeah, no, it wasn't a question, but it was just basically by Tiffany Morales. She said that she can't wait to get started. So we're looking forward to. Mm-hmm.
Excellent. Glad to hear that, Tiffany.
So again, if you have questions or if you have anything that you would like to share with Frank, you see on your screen Frank's email address. You can either contact Frank directly, or you can send us an email to to either Fide or myself, and then we will be happy to forward it to Frank. Sorry, Frank, what?
Excellent.
Supposed to say something?
No, I was just going to say, just as a finish here. So next time we meet on the 16th, I really do want each of you to let me know how this has gone for the last 2 weeks. So be prepared either to be on screen or to talk. I know you're shy, but it really is going to be helpful for all of us to know what the experience has been for you in setting this up and getting it started. So please don't hesitate to share your thoughts when we meet again the next time. And then we will go over sessions 3 and 4 at that point, like we did today with these first 2 sessions. All right, if there's no other questions, and I'm fine. Thank you for attending.
Thank you, Frank. And before you leave, please visit our website, nchph.org. You will find the recording for this session, the previous recording. And you can also find additional information on upcoming activities and publications. Also, we are going to share the link for the motivational interviewing webinar that Frank mentioned in the beginning of the session. You can also join us. You can join our mailing list, and you will get information on HRSA updates, funding opportunities, and additional information on the upcoming activities. These are our the name of our staff. If you have any question, please feel free to contact either of us, and we will be happy to get in touch with you. Again, you can also contact directly Frank if you have any questions on your smoking cessation program. Thank you so much and have a great afternoon. Thank you, Frank.
All right. Thanks. Goodbye.